The Injured Senior Podcast is here to help. Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing homes, assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. Your host, Steve Heisler, creator of the National Injured Senior Law Center, has been advocating for seniors' rights for over 30 years and is bringing you answers to your questions. This is the Injured Senior Podcast.
This is Steve Heisler, and you're listening to the Injured Senior Podcast, and we are talking to Dr. Pamela Teaster. Now, Dr. Teaster, you are an expert in elder abuse. Your wheelhouse is not just restricted to public guardianships, and you've written some articles about sexual abuse in residential care settings. So, what kind of sexual abuse are we talking about?
That is really a determination by statute. So it depends on what the state regards as what is sexual abuse. But when we did our study, and I did that with the wonderful Dr. Holly Ramsey Klosnick, she and I used a wide definition of what sexual abuse was, including kissing and fondling, as touching, not just rape, but a wider definition, and ultimately left it up to what the state and we did this through Adult Protective Services. So whatever APS said sexual abuse was in the states that we studied, that's what it was.
Okay. And I mean, how prevalent is it? How much is it going on to the best of your knowledge? Good
question. I want to know that. I have not conducted a prevalence study. My studies are generally more on the intervention, investigation, outcome side of things. Of the people who have done the work on the prevalence of this, 0.5%, one study got up to the one I ever saw that was the highest was about 7%. So it's not a huge number. But again, we know that there are underreports of abuse. If this one, and I've written it, is the most taboo of all the kinds of abuse, then wouldn't we expect that this is the most underreported of all kinds of abuse?
Now, in your research, did you find that it was more from staff or other residents, or kind of like a mixture?
Other residents.
Really?
Yes.
Okay. And
yeah.
Can you get?
Do you want to know my take on that?
Yeah, sure. That's why we have you on the show, Dr. Teaster.
I guess you do. So here was an interesting thing we discovered, and then we could talk about that a little. So what we discovered was when there was an allegation of sexual abuse by a resident in the facility, that was generally substantiated. When there was an allegation of sexual abuse by staff in a facility, that was generally not substantiated by APS. So it was surprising that there was a reticence. I'm not saying necessarily that staff are sexually abusing residents, not anything like that. But I'm saying of the cases that were reported to APS, there were often more allegations coming in of sex abuse by staff. But what came out as substantiated was sex abuse by residents.
Why do you think that is?
I knew you'd ask that, and I wrote about it. I think it is easier for. I think it's a difficult report to investigate. I think it is easier to substantiate abuse by a resident than it is by a staff member. For one thing, and when you use an expansive definition of sexual abuse, I think there just would be more sexual abuse, but there are more residents involved in a facility who might be sexually abusing than there are staff who might be sexually abusing. But I think, when it's a staff member, it's more difficult to prove. I think some facilities are hesitant to report a staff member. Some, most are not, but some are. But that accounts for part of that problem.
Yeah.
And it's just easier to wrap your head around.
Yeah.
But you know, for the two of those, the solutions are quite different. So if you found in a national study like we did that the predominant sex abuse was by residents, the remedies are quite different from those for staff. I did also find in some of the work we did some racism. This work was 10 years ago now, but perhaps sometimes staff members were blamed more readily. It was just surprising. Some of the staff members who were blamed and then went to courts were sometimes more often not a very diverse population, but not always. I was just surprised that sometimes it was the black orderly, and I thought, I'm wondering that really could be the case. Not a big enough sample to make any profound statement about Steve because it was all a small number, but it was just I added that in the mix of some early work that was done.
No, that's interesting, and if that is the case, that's definitely
a problem.
Very that's problematic, and Now, it's interesting. We had Dr. Nicole Diddick on the show a couple weeks ago. She is a gerontologist in Canada. Mm-hmm. Now, it's interesting. She talks about sex in residential settings, residential care settings between residents. And she actually says that if, like dad gets a girlfriend in a nursing home or in an assisted living, that maybe it's not a bad thing. So I'm just wondering if there's like a fine line between sexual abuse and just two elderly individuals who are, just developing a relationship or in a relationship. Did you see anything like that maybe caught your eye?
That's a really wonderful question, and of course we have had to wrestle with that. And as an ethicist, another thing in my wheelhouse, we certainly don't want to limit the freedom of any individual, regardless of the care setting they're in. When it becomes problematic is when the capacity issue begins to surface, as you know, as an attorney. So the sex abuse part, of course, comes when there is sex that is unwanted, and it moves along in many, to the extreme. It's a crime. When it is kissing and fondling, I don't think anybody's going to court over that, but it's unwanted, and we classify it as sex abuse, so I do need to know that. For adults who are consenting, why does sex stop at a particular age? It shouldn't. And could two adults with mild cognitive impairment be consenting and have sex that they should be able to have? Well, of course. So we wouldn't want to call any two people at a facility, even with mild cognitive impairment, people who are one person who is sexually abusing another. In fact, we would want to promote that. I think we would. Family members, I'm sure this professor you talked to mentioned this. Some of the problems lie around the family members who have a problem with that for a whole lot of reasons. Some care providers have a problem with that for reasons we may or may not discuss on this podcast. But we want to promote. We do as adults want to promote sex and happiness and flourishing at all kinds of ages with all kinds of intellectual capacity, as long as a person is able to make decisions about his or her own body. That's what we want.
No, it's really thought provoking, and there's no easy answer as to it's something obviously we're getting.
It even comes up in guardianship. Often, I think the guardians even have a question about, should they allow an individual under guardianship to have sex with another person? I think they struggle with that one. And the answer is, as I know you know as an attorney, it depends.
Yeah, well, if it's someone with Alzheimer's or somebody, like you said, is cognitively challenged or impaired, it gets a little more fuzzy.
Sure.
Yeah. Well, Pam, I know you feel like you've just been interrogated by Mike Wallace. I want to thank you for taking the time from your busy schedule over there at Virginia Tech to be with us today. And all kidding aside, that's really good information that you just gave us. And I'm definitely going to want to have you back because there are so many different topics in your wheelhouse and things that you really do have a lot of expertise on.
Yeah, I'll tell you one right now, Steve, that I'm working on. They all have relationships to each other, as you can imagine. I know your listeners will recognize that. The thing that we're working on today is working on end-of-life decision-making for people. And this is a thing called POST. At least in Virginia, it's called that, Physician Orders for Scope of Treatment. And we're trying to work on that for individuals in rural areas. So often older adults who have about a year to live. And so we're doing some research on that as I speak on that topic right now.
Oh, that's definitely a big interest. We have a lot of listeners who live in rural America, and so that definitely is pertinent. And we're going to want to have you on to talk about that.
I will like
now,
that.
Yeah, Pam, if anybody wants to get in touch with you to discuss any of these topics, I know you're a professor. You're not I don't think you practice gerontology and see patients or whatever. But if someone wanted to contact you to maybe discuss some of the issues we talked about today, what's the best way to reach you?
I think the best thing to do would be able to, one of two things. One would be to call the Center for Gerontology at Virginia Tech. And all you have to do is look on a website at Virginia Tech Center for Gerontology, and there it will be. And our wonderful operations coordinator will find me and get me a message. The less reliable, although possible, thing to do is you can easily Google me. There I'll be. Some picture, who knows how many years ago, but I probably still look like that. If you can find my email address, you're welcome to email me. Once in a while, I lose them because I get a lot of them. So that's why I would say if you have a burning question, call, because I know my operations coordinator will get to me with that. Less reliable, but still, I get about 300 or 400 emails a day. I'll usually get to as many as I can in a day. 300 to 400 emails to the gerontology department? No, to me.
Just to you?
Yes.
Wow. Well, that's about 300 to 400 more emails than I get.
300 less than you get, Steve.
Yeah. Well, yeah, you've been doing this a long time, so I guess that's a testament to your good work. People, they want to get some good information, and you're the person to see about that. All right, Pam. Well, thanks again for being on the show, and we're going to have you back soon.
Steve, thanks for inviting me. I appreciate it. Keep doing your good work.
I appreciate it. Injured senior and aging population community, thanks for listening to today's episode. I want to again thank Dr. Pamela Teaster for appearing on the show today. She did a wonderful job and just so much great information. If you love the Injured Senior Podcast, we'd love for you to subscribe, rate, and give a review on iTunes. If you want to share a story that you have about guardianship or any type of elder abuse, we would be happy to talk to you and possibly have you come on the show to tell us about your experience. Or if you just have any suggestions or comments about the show, you can email me at steve@injuredseniorpodcast.com. I definitely respond to all emails and would love to chat with you or exchange emails. So until next time, I am so looking forward to next week's show, my friends. It was so great to spend some time with you. Stay safe, and I will talk to you soon. Goodbye, everybody.
Thanks for listening to the Injured Senior Podcast. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. Connect with us at injuredseniorpodcast.com and sign up for our newsletter. To find out more or to get help at any time, visit injuredseniorpodcast.com or call 855-622-6530. That's 855-622-6530.